Hi, my name is Peta Tauchmann, and I'm a nurse practitioner and credentialed diabetes educator. Today, on behalf of EduVid, I'm going to talk to you about diabetes myths and facts. In this session, I'm going to talk about some common diabetes myths and consider some facts about diabetes. As a full-time diabetes educator and nurse practitioner, these are the most common questions that I'm asked by people who have diabetes, and also by healthcare professionals. First, some facts about diabetes globally. The International Diabetes Federation produces the Atlas of Diabetes every year. In December of 2021, there were 537 million adults in the world with diabetes mellitus. 85 to 90% of those people have type 2 diabetes, and around 10 to 15% have type 1 diabetes. In Australia, statistics for diabetes are collected by the National Diabetes Services Scheme. Every NDSS registration form contributes to the collection of data about Australians with diabetes, and this helps the government to plan infrastructure and funding needs for people who have diabetes. The NDSS tells us that in Australia, 8 to 9% of Australians have some form of diabetes, but only 4.6% of those have been formally diagnosed. Every day there are 332 new registrations for the NDSS. In Australia, in 2012, we had 999,000 people with diabetes, but in 2021, that number had increased to 1,426,245 people. That's an increase of around 500,000 people. So what is type 1 diabetes? It's a complete absence of insulin production that's caused by an autoimmune response to the pancreas. The autoimmune system doesn't recognise insulin as being something normal, and it sets about removing it from the body, just like it would a cold or a flu. Type 2 diabetes is caused by insulin resistance and relative insulin deficiency. Insulin resistance is an impaired biological response to insulin that can be improved with increased activity and weight loss. There is an increase in the production of insulin from the pancreas in response to higher glucose levels. And this is also caused by hepatic glucose production, or what we call glycolysis. Insulin resistance is thought to be caused by a flaw in evolution. If you think of the feast and famine that cavemen used to have to put up with, when they couldn't pop down to the supermarket and buy a loaf of bread and a bottle of milk, our bodies have adapted from that. And the effect of insulin resistance is increased insulin production, an increase in stores of glucose, and the insulin receptors become less sensitive, leading to hyperglycemia, particularly in the fasting and the 2-hour post-meal state. All red blood cells have a thing on them we call an insulin receptor, and the attachment of insulin to this receptor allows a complex exchange of chemicals to occur. A door is opened, allowing the glucose to exit the cell. I liken these receptors to jigsaw puzzle pieces, and this is how I explain it to people who have diabetes. I talk about the insulin and the red blood cell needing to connect together, and they lock in neatly, and when the two things aren't working properly, then it's like a jigsaw puzzle piece that doesn't match. So now, let's take a look at some common myths about diabetes. Myth number 1. Diabetes is caused by eating too much sugar. The idea that a person has diabetes because they ate the wrong food is possibly the most common myth that I hear in my clinics. The reason for this can be found in history. The symptoms of diabetes were first described in the Ebers Papyrus in 1550 BC, and in 150 BC, Aretaeus named diabetes mellitus for what he observed about it. Diabetes is a siphon, and mellitus equals sweet. To go a little bit further into that, in ancient Greece and Rome, people used public latrines, and it was noted that ants were attracted to the urine of some people, but not others. So it was observed that the urine of those people that the ants were attracted to was sweet. Hence, diabetes mellitus was named for the passing through, or a siphon, of sweet water, mellitus. Myth number 2. I have borderline diabetes. Well, this is a common one that I hear. And I think having borderline diabetes is a little bit like being borderline pregnant. It's old terminology, just like NIDM and IDM, that we've stopped using as our knowledge of diabetes has increased. But you can have pre-diabetes, which will either be impaired glucose tolerance or impaired fasting glucose. And this is determined by the use of a glucose tolerance test. Why does the terminology matter? Because our understanding of diabetes allows us to address the specific risk factors. And two major studies have been conducted. The first is the Diabetes Prevention Program, and the second is the Diabetes Prevention Study. These large studies showed that intensive lifestyle modification could prevent or delay the progression to type 2 diabetes in up to 58% of participants. This meant that they needed to do 150 minutes of moderate intensity exercise per week. Some key messages from these two studies were to lose weight and make better food choices, to be more active, 150 minutes of moderate intensity exercise per week, or just move. With medication, we want to treat the rest of the body well to prevent macrovascular complications. Myth number 3, if I get skinny and I exercise a lot, my diabetes will be cured. This popular message has been promoted in the media by celebrity chefs, some doctors, and lifestyle coaches, and it's really oversimplified. Remember that people with type 1 diabetes have a total absence of insulin production that cannot be replaced or repaired. And there are many people with type 2 diabetes who are already physically active and of healthy weight. For those people, insulin resistance is not the only driver for their diabetes. People with type 2 diabetes who are overweight and inactive can improve insulin resistance by making changes to their lifestyle. And we know that a loss of only 5% of the total body weight will improve insulin resistance and blood glucose levels. I think more importantly though, anyone exercising regularly, regardless of their weight, will be healthier than a lean person who does no exercise at all. The final thought is no one can predict your future health. And to say that diabetes will never return is false. Myth number 4. Type 1 diabetes is worse than type 2 diabetes, and I think this idea comes from the perception that insulin therapy is a last resort in the management of type 2 diabetes. In fact, the United Kingdom prospective diabetes study demonstrated that the risk of macrovascular complications in people with diabetes is higher in those with poor glycated haemoglobin. The type of diabetes was not so important. The UK PDS also proved that reduction in blood glucose levels also led to reductions in all-cause mortality at all diabetes-related endpoints. That includes microvascular complications, an MI, cataract extraction, retinopathy and renal disease. The UK PDS also told us that postprandial blood glucose levels are a predictor of macrovascular disease in diabetes, and later studies have refined our stratification of risk related to hyperglycemia and led to individualised recommendations for blood glucose targets. Type 2 diabetes has a natural progression that is not always improved with lifestyle modification. First, insulin resistance occurs, with higher insulin production and increased fasting and postprandial blood glucose levels. Next, the beta cells in the pancreas become less responsive to the presence of glucose, and insulin production therefore wanes. This is called relative insulin deficiency. Now, that isn't to say that diet and lifestyle isn't good for people with diabetes, because it most definitely is. But we just need to choose our words carefully and support people rather than tell them that losing weight will cure their diabetes. Myth number 5. If I need insulin, my diabetes is really bad. The fact is, insulin can be needed by anybody who has diabetes. During surgery, if they have symptomatic hyperglycemia, during pregnancy, perhaps for weight loss, or problems with taking diabetes medications. Insulin is helpful when the HbA1c is rising and the maximum amount of oral glucose lowering agents is prescribed. Sometimes it's a personal preference. In heart disease, we know there's good evidence for health with the use of insulin in diabetes, and we'll often recommend it for foot ulceration and where painful neuropathy is present. Myth number 6. Because I have diabetes, I will be sicker than other people. And my response to that is that wellness is not determined by a diagnosis, and other conditions are at play here. It can be that there's medication that's needed for other health conditions, or that lifestyle choices are making a big difference to the diabetes outcomes. We recommend blood glucose monitoring and the use of finger prick testing routinely to check for changes in treatment and changes in glucose levels. Another measure of glycemia is what's called the HbA1c, or glycated hemoglobin, which is an average of all of the glucose attached to the red blood cell over the preceding 3 to 4 months. It should be done during regular complications screening every 3 to 6 months. Myth number 6. Sugar and carbohydrates are evil and should be punished. Remember that carbohydrates are the body's main source of energy and they're necessary for normal brain function. They help our body's muscles work better and supply the body with essential vitamins and minerals. A lot of our carbohydrate-based foods also supply the body with soluble fibre. For comparison, carbohydrates contain about 4 calories per gram, the same as protein, but fat contains about 9 calories per gram. I hope you've enjoyed this session on diabetes myths and facts. Hopefully you have learned that not all myths are facts, and some interesting information about diabetes along the way. If you would like to learn more about diabetes, I suggest visiting the Diabetes Australia website or the website of the National Diabetes Services Scheme. You can also visit the website of the Australian Diabetes Educators Association for more information about diabetes management and the work of diabetes educators.
My Health PD, more than just CPD.